In the ICU, we definitely work with the sickest of the sick, but it's a little bit challenging because the simple steps that need to be taken in order to try to prevent the transmission of the virus, I don't see that it's always being adhered to.
It doesn't just affect you. You could not show symptoms. You could be asymptomatic the whole time and still have it and pass it to someone who will die from it.
It makes me frustrated when I see people not wearing masks out in the community just because they're not taking it seriously when it is really serious, and we see people get really sick.
You're no longer just seeing one patient, you're seeing their whole family. You'll have married couples down the hall from each other, then their kids are coming in, their parents are coming in. It's becoming just widely spread in families, and they don't have anyone to be with them. Their loved ones are sick. We're not allowing visitors, and it's just definitely taking over entire families instead of just individuals themselves.
The most important thing, obviously, is to protect yourself and protect your loved ones, and without a question, everybody should be wearing a mask in public spaces. The effects of COVID have been very tiring. It's a lot of long hours at work, and it's stressful at home because we don't have a lot of family support.
As a therapist, we want to see people get better, but we see so many people that are not going to get better. And when their family members can't see them suffering, sometimes I say do all the things, and sometimes that's just as much torture because they can't see how sick their loved ones are.
And we could tell sad story after sad story every day for each of the patients that we see here, yet there are still many people who don't want to believe. There's still many people who don't want to comply with mask wearing, social distancing, and trying to contain the virus. And so on a personal level, that feels a little bit heartbreaking.
It is, it's heartbreaking. The community doesn't see what we see. We a wife saying goodbye to her husband before he gets put on the vent, and they may not see each other again, ever. The community doesn't see that.
If wearing a simple face covering can help save a life, or even your family members' lives, your friends' lives, why wouldn't you do it?
Nurses, respiratory therapy, everybody from the ER door all the way up in this building is working for the people of Midland. We are exposing our life. We are not the bad guy. We are not. We are doing our best. We are fighting for your family members.
We ask that everyone just please listen to your healthcare professionals. We are seeing it firsthand, and we ask that you take us into consideration, take your family into consideration, wear your masks, social distance, and just please follow the guidelines.
Here at Midland Memorial, we do have your back, and we're ready for whatever COVID's going to bring to us, but we just hope that they are taking precautions and being as safe as possible so we can help keep them safe as well.